Hello everyone, and welcome to a new session of clinical pharmacology. Today we are going to speak about spasmolytic, and which is known as skeletal muscle relaxant. Uh, we're going to speak about three main group, the group of medication that directly act on skeletal muscles. Then we are going to speak about central acting relaxants. Then in the last group will be neuromuscular relaxant agents. So first of all, we need to differentiate between spasticity and spasm. For this reason, we are going to apply our medication to work as anti-spasticity or antispasmodic. So we are going to differentiate between spasticity and spasmodic. Then we will move to the pathophysiology and physiology of the central nervous system and the neurons in order to speak about the depolarization, which neuron will be involved in the skeletal muscle or skeletal spasm. We are going to speak about glutamate. We are going to speak about GABA receptor interact with each other. Then we move to the location, site of location of the medication, classification of the skeletal muscles. Then we are going to speak about individual drugs such as Carisoprodol, Baclofen, Tizanidine, Diazepam, Dantrolene, and so on. Then we are going to speak about Cyclobenzaprine, about maybe some advantages, characteristic for each medication. The last medication in this skeletal muscle relaxant will be botulinum toxin, which is known as Botox. And Botox mainly used for several indications. We are going to speak about that later on. Then we have three other medication maybe involved in several field of treatment, such as gabapentin, such as pregabalin, and duloxetine, and brand name for duloxetine Cymbalta. So this is our outline for today, and I will start now in this discussion. Okay, this table here compare between spasticity and spasm. As you can see here, spasticity refers to the lesion in the upper motor neuron, and this will lead to the hyperexcitability, involuntary contraction of skeletal muscle, and muscle weakness. This is related to the spasticity. So we need to remember spasticity associated with the upper lesion in the upper motor neuron. Some example for the lesion in the upper motor neuron, lesion in the central nervous system. As you can see here, we have multiple sclerosis, cerebral palsy, spinal cord injuries, traumatic brain injury, and post-stroke syndrome. What medication we use it here for patients suffer from upper motor neuron lesions such as sclerosis, palsy, cord injury. We have four medication for the spasticity, and we call this one antispasticity. So what we have so far here, you can see it. We have diazepam, baclofen, dantrolene, then tizanidine. So four medication. Moving to the another group of medication, and this refer for the spasm to treat the spasm. This spasm refers to the peripheral musculoskeletal condition that causes cramps and muscle pain. So the lesion and the patient come to the clinic suffer from peripheral musculoskeletal condition, suffer from cramps and muscle pain. Some example for that: fibromyalgia, very popular, low back pain, neck pain, tension headaches, myofascial pain, and muscle spasm. So if the patient suffers from peripheral muscles, what medication we are going to use? We have a list of medication, and this considered like antispasmodic. We have Carisoprodol, we have chlorzoxazone, we have cyclobenzaprine, then we have orphanedrine, tizanidine. Okay, so this group of medication, Carisoprodol, cyclobenzaprine, tizanidine, used for peripheral musculoskeletal conditions such as fibromyalgia, neck pain, low back pain, headaches, myofascial spasm, and muscle spasm. You can see here at the top or at the bottom of this table here, they said we have something in common between two cases. If the patient coming with a spasticity or spasm, we have two medication share the common area. They said tizanidine and diazepam could be used for both cases. So if the patient come to the clinic suffer from spasticity, we can describe tizanidine or diazepam. If the patient come to the clinic suffer from cerebral palsy, we can prescribe one of these. So the purpose of this medication to relax the skeletal muscle, not to treat the disease. For example, tizanidine diazepam is a medication used to treat spasm due to the multiple sclerosis or cerebral palsy. We do not use tizanidine and diazepam to treat multiple sclerosis. We don't use it to treat cerebral palsy. We use it to the skeletal muscle that result from the spinal cord injury, for example. Okay. For patients suffer, come to the clinic suffer from fibromyalgia, we can use one of these medications: Carisoprodol, Cyclobenzaprine, or phenidrine, tizanidine. Low back pain, neck pain, the same. Myofascial pain and muscle spasm. Okay, which of the following, the case study here or like question, which of the following clinical condition associated with spasticity? Select all that apply. Low back pain, stroke, fibromyalgia, multiple sclerosis, or cerebral palsy. So the situation here, we ask about spasticity, and if you remember that spasticity related to the upper, to the lesion in the upper neurons, and this one is not on the low back pain. This is peripheral, not in fibromyalgia. This is peripheral, but this one could be in the stroke. This is upper motor neuron. Could be multiple sclerosis, and the last one cerebral palsy. This is the correct answer. The circle one: stroke, multiple sclerosis, and cerebral palsy. Okay, now we need to understand the site of action, how our medication work. In order to understand how our medication work, we need to understand how the neurons communicate in our brain. How the, for example, glutamate neurons, how the glutamate neuron work, release the maybe the contents, and cause the action potential and stimulation. This is a glutamate. Moving to another side, how the GABA work and what is the role of GABA in the pain modification. So as you can see from this graph here, I will clean this one here just 1 minute. As you can see here, what we have, glutamate will be activated by the entry of calcium and sodium to the neuron, and this will maybe create like decking on the fascicles, allow the fascicles to release its content from the glutamate. The glutamate will maybe stimulate both synaptic receptor. We have here, we have AMPA, we have NMDA receptor here. We have another receptor here. We can do it like MDA here, another receptor responsible for the calcium here. So as you can see here, when this receptor activated, the result will be action potential. The result will be depolarization. The result will be stimulate skeletal muscle contraction. Okay, now we have the skeletal muscle stimulated, the skeletal muscle or contraction. On the other hand, we have GABA. GABA practice the control of inhibitory effect. You can see it here. So we have we have stimulatory effect from the glutamate. We have inhibitory effect from the GABA interference. Okay. Here also we need to look what we have. Some components, some sites is very important for us as a location of action. For example, here, number one, we need to look on we have alpha 2 receptor. This is alpha 2 adrenergic receptor. Alpha 2 adrenergic receptor. What we have? We have GABA B. GABA B available in the presynaptic, GABA B available in the postsynaptic. We have GABA A. So we have two type of GABA here. What else? We have AMPA, sodium. Okay, what else do you have? We have a receptor on the skeletal muscles called ryanodine receptor. So this represents the target for our medication. First of all, we look on the ryanodine receptor. We have calcium. Okay, ryanodine receptor. This number one. This is first target. The second target will be GABA B. Okay, the third target will be alpha 2 adrenergic, and last target will be GABA A adrenergic. So we have several targets for the medication. RYR1 stand for ryanodine receptor channels in sarcoplasmic reticulum. SR stand for sarcoplasmic reticulum. Okay. Now we try to apply our medication on this pathophysiology and physiology. If we need to use medication to induce muscle relaxation due to the direct effect on skeletal muscle, so we're looking for medication has direct effect on the skeletal muscle, we're going to use dantrolene. Dantrolene inhibit the ryanodine receptor and inhibit release of calcium from the skeletal muscle. So number one, dantrolene. Dantrolene block the ryanodine receptor and inhibit release of calcium from skeletal muscle. Therefore, the end result will be skeletal muscle relaxation. Moving to the second one, for example, here we have baclofen. Baclofen, you can see it in two places. Baclofen, here we have to say stimulate. Baclofen stimulate GABA B, open chloride channel, and cause hyperpolarization. And the result will be, when you talk about hyperpolarization, the result will be skeletal muscle relaxation. Okay, the result will be skeletal muscle relaxation here. Okay, because baclofen stimulate GABA. Okay. Okay, this is number one, dantrolene. Number two, baclofen. We have it here. Number three, we have tizanidine. Tizanidine considered like agonist, which mean tizanidine agonist stimulate alpha 2 receptor, and this will lead to the activate GI protein, okay, and decrease release of mediator tizanidine. And this medication remind us with another medication called ryanodine. Okay, so quickly here, only to maybe refresh our mind about what we have. Here we have clonidine. This is alpha 2 agonist, and this medication mentioned in the hypertension drugs or hypertension medication, lower blood pressure. This medication lower blood pressure. This medication work on the blood vessels. Okay. Then they developed something called tizanidine or tizanidine. Tizanidine block alpha 2. Tizanidine stimulate, and here the same. And you can look on the suffix here, tizanidine, clonidine, and the result will be here. We are talking about the neurons. So clonidine work on the neurons, central acting, but the effect will be on the blood vessels. Tizanidine work on the neurons, and the effect will be on the central nervous system and muscle relaxation, and the result will be muscle relaxation. Now we have two medication belong to the same group. We have clonidine for blood pressure, tizanidine. This is a medication used for skeletal muscle spasm. So the third one will be tizanidine. Okay, the third one will be tizanidine. The last one here we have benzodiazepine. Benzodiazepine activate GABA A. Benzodiazepine activate GABA A. We have list of medication. Could be diazepam here. Could be lorazepam. Could be midazolam. So we have list of medication to belong to the benzodiazepine. So here benzodiazepine activate, again we need to write plus here, activate GABA A. So the question now, give me medication activate GABA A and induce muscle relaxation, benzodiazepine. This is a group of medication. Give me a medication, diazepam, another medication, lorazepam, another medication, midazolam. All these medication could be used to induce skeletal muscle relaxation. Keep it in your mind. Give me medication stimulate GABA B and use for skeletal muscle relaxant. Okay, we have baclofen. Which of these medication work directly on skeletal muscle by inhibit receptor called ryanodine and inhibit release of calcium? We have dantrolene. Okay, so we can create several questions from this slide here. Again, this is what we show in the slide: dantrolene, the first medication, baclofen, tizanidine, benzodiazepine. So we have four main group of medication belong to this list here. Okay, this slide here it considered like important slide for us. Okay, the question here: what is the purpose of this slide here? They said if we have regarding skeletal muscle relaxant, we have antispasmodic. We need to remember the antispasmodic medication here. Oops, go home again. Spasmodic. Okay, we need to remember antispasmodic medication and antispasticity. For antispasm, we have cyclobenzaprine, orphanadrine, chlorazoxazone, and then for spasticity, baclofen, tizanidine, dantrolene. We can add 3 and 5. 4 and 5 here we have tizanidine, diazepam. But tizanidine, diazepam maybe share the both activity as antispasticity or antispasmodic. So we can use it for both, even for peripheral or for upper motor neuron lesions. So diazepam, tizanidine share both of the category as spasmodic, antispasmodic, or antispasticity. The question here we can ask ourselves: give me medication could be used for only for antispasmodic. So we have cyclobenzaprine. Give me medication only used for spasticity. We have baclofen, tizanidine, dantrolene. Give me medication used for both spasm and spasticity. We have tizanidine and diazepam. Okay, now we have a matching question or like matching statement here for the we need to familiarize ourselves what we have A and B: spasticity, antispasmodic. Is this related to the upper neuron or the peripheral neuron? So if for A here stands for the A here. So upper motor neuron lesions. This is antispasticity. And for the, if you moving to the green one, for the B, peripheral musculoskeletal condition belong to the B here. So as you can see, I will start with the A with the red color. First we can go with the green. Second we can go with the green color together. So traumatic brain injury. What do you think? This one upper neuron or lower neuron? Peripheral neuron. If you said upper, you are correct. I will say A. Okay, tension headache, I will leave it. Spinal cord injury, this is upper. Post-stroke syndrome, okay, affect the brain. Neck pain, myofascial, multiple sclerosis, cerebral palsy. So this is upper. Okay, give me medication work on upper motor neuron. Upper motor neuron. Okay, diazepam, I will say A. Baclofen, A. Okay. What about dantrolene? Can you say A? Carisoprodol, cyclobenzaprine, tizanidine. This is all A. Okay, moving to the peripheral one. So which one work on the peripheral? Headache, tension headache, peripheral. Okay, what about neck pain? Peripheral, myofascial pain, peripheral. Low back pain, peripheral. Carisoprodol, peripheral. What about cyclobenzaprine, peripheral? Orphanadrine, peripheral. We have to stop here a little bit to look on the number 1 and number 7. Okay, number 1 not only peripheral but work like on the antispasmodic. So we can type A and B. Tizanidine, we can type A and B. Here we need to remember this one here and this one here. Okay, this is matching question. Okay, starting with the first medication on the list here, Carisoprodol, the brand name Soma. This medication considered like sedative drug, scheduled drug 4, sedative drug, scheduled drug 4, according to the substance abuse disorder. This medication metabolized to the mepromate, which is belong to the scheduled drug 4, according to the CDC controlled drugs. This medication, if you take this medication for a long term of treatment, like more than 3 weeks every day, and you try to stop this medication, it's recommended to stop this medication gradually, because if you stop this medication suddenly, the patient will suffer from physical withdrawal symptoms such as anxiety, tremors, muscle twitching, insomnia, hallucination. So the first medication here could cause physical withdrawal effect will be carisoprodol, because carisoprodol may cause like withdrawal symptom. And the withdrawal symptom include anxiety, tremor, muscle twitching, insomnia, hallucination. Okay. Okay, this is a screen from Google Images. You can see the brand name Soma for the Carisoprodol, or available like generic name Carisoprodol. We have it like in several brand name, but the generic name Carisoprodol. And remember, this one like work as peripheral medication, work as antispasmodic medication. Okay, moving to the next medication, Baclofen. Baclofen GABA B agonist. Baclofen GABA B agonist. Remember this one here, GABA B agonist, Baclofen. Okay, Baclofen cause hyperpolarization, which means muscle relaxation, induce muscle relaxation. Baclofen used for any case such as spasticity, okay, such as multiple sclerosis, spinal trauma, and so on. Baclofen may cause sedation, insomnia, dizziness, weakness, because baclofen inhibits the brain. Baclofen inhibits central nervous system. So when you inhibit central nervous system, the situation will be sedation, insomnia, dizziness, weaknesses. Patient should be reduce this medication also slowly, because there is a risk of abrupt withdrawal effect. Okay, Baclofen. So if you click on the link here for the data, for the information, Baclofen. Okay, let me share the result with you about Baclofen here. The first thing here in the black box warning, abrupt discontinuation of this medication could result to the withdrawal effect. They said prevention of abrupt withdrawal of intrathecal Baclofen. Intrathecal Baclofen mean inject the Baclofen inside the central nervous system directly in the spinal fluid. So intrathecal Baclofen as a muscle relaxant, skeletal muscle relaxant. Okay, look how this medication work. As you can see, this medication work on GABA. This medication work on GABA B. Okay. Again, indication for this medication. Okay, this medication, Lioresal, this medication intrathecally we use for patients suffering from spasticity. So when you use it as injection inside the central nervous system, intrathecal, we use it for severe spasticity. But do we have tablet? Sometimes, yes, we have tablet. We use it for chronic cases there. Okay, so we're done with the first one, Carisoprodol, Soma. The second one, Baclofen, Lioresal, and the third one, Tizanidine, and the brand name Zanaflex. Tizanidine, short-acting skeletal muscle relaxant. Short-acting skeletal muscle relaxant. Work as alpha-2 adrenergic agonist. So we have now two agonists. For example, if you go to the GABA, Baclofen agonist, Tizanidine agonist. Tizanidine used for management of spasticity in general. So you can maybe count how many lesions, how many diseases related to the spasticity. Again, we need to avoid abrupt discontinuation of this medication, because if you stop this medication suddenly, the result will be withdrawal, rebound, hypertension. Okay, alpha adrenergic related to the hypertension control. If you stop the medication suddenly, the result will be rebound hypertension. Okay, so the question now, which of these skeletal muscle relaxant, if you stop it suddenly, may associated with the severe hypertension, will be Tizanidine. Okay, Tizanidine, if you because we already discussed, we have Tizanidine and then we have clonidine. They said Tizanidine has a approximately 1/10 to 1/15 of the blood pressure lowering effect of clonidine. For example, if you prescribe, for example, 10 milligram of clonidine to maybe control or to lower blood pressure, Okay, and you have tizanidine for your patient, and the patient on 10 milligram tizanidine for skeletal muscle. If you maybe expected to see effect on blood pressure, you need to prescribe 10 times like 100 milligram tizanidine. For example, here the patient should take 10 tablet tizanidine in order to produce effect on the blood pressure. So this one considered like toxic dose or overdose. Okay, so the question now, with the therapeutic dose, there is no effect on blood pressure. When you give overdose or toxic dose of tizanidine, this will affect blood pressure. This one here reminds us with something called potency, and this will be discussed in the pharmacokinetic in more details. Okay, if you click on the link here again to show you what we have for Zanaflex, only to discuss maybe some important maybe concept for the tizanidine. Okay, tizanidine available like tablet, available like capsule, and approved by the FDA since 1996. Tizanidine Zanaflex, central alpha 2 adrenergic agonist. This is a key word, central alpha 2 adrenergic agonist, used for spasticity. Okay, and Zanaflex reserved for the patient for those daily activity times when the relief of spasticity is most important. Short duration of action. Okay, that means you can take this medication and practice your daily activity, because this medication only short duration of action. There is no effect on the entire day, for example. Okay. Okay, the next medication on the list here as skeletal muscle relaxant, we have diazepam and the brand name Valium. As you can see here, diazepam belong to the group of medication called benzodiazepine. So benzodiazepine is like group of medication, and diazepam one of these medication. How this medication work? They said that benzodiazepine binding to the GABA receptor and facilitate GABA. And we have it in another slide they stated that when benzodiazepine bind to the GABA, this will open a chloride channel and cause case called hyperpolarization. So hyperpolarization will be the case, and the result will be skeletal muscle relaxant. Skeletal muscle relaxant, that is due to the binding to the GABA. GABA A opening chloride channels cause hyperpolarization, and this effect will be on the central nervous system. Again, for diazepam, it's recommended to avoid abrupt discontinuation, avoid stop this medication suddenly, because this medication, if you use it for long term, more than 3 weeks, 1 month, and try to stop this medication suddenly, the result will be withdrawal symptoms. And we are going to discuss some sign of withdrawal symptoms in the opioid, similar to what you have like agitation, insomnia, tremor, anxiety, and so on. This medication use diazepam. We can use it to reduce anxiety. This action and uses. Action, reduce anxiety, sedative effect, hypnotic action, anticonvulsant action, and muscle relaxant. According to these actions, we can use it for therapeutic cases. We can use it for patients suffer from anxiety, for patients suffer from insomnia, sleep disorder, unable to sleep or sleep for short period of time. This medication help patient to sleep, facilitate sleeping. This medication used for patients suffer from seizure, especially if we talk about status epilepticus. This medication used for skeletal muscle as a skeletal muscle relaxants. So as you can see here, we can ask the question, can you maybe mention what is the clinical use of diazepam? So diazepam used as anti-anxiety medication. Diazepam used for patients suffer from seizure, such as status epilepticus. Diazepam used for as hypnosis, induced sleeping, and diazepam used as skeletal muscle relaxant. Let us click on the link here, and this for us we can take us to the drug prescription. This is 12 pages about diazepam. You can read it at your own time. With this link here, the volume for the diazepam, how this medication work. You can see the GABA here work on the as inhibitory neurotransmitter in the nervous system. Scroll down to read information about indication. I like the indication. Uses: diazepam used for anxiety disorder. Diazepam used for the withdrawal, alcohol withdrawal. Yes, because when the patient stop taking alcohol, the patient will start suffering from anxiety, agitation, tremors, and the medication Valium used to treat these symptoms. Also, Valium or like diazepam is like a useful adjunctive agent for relief skeletal muscle spasm. So you can see it in convulsive disorders. We can rely on this medication for this maybe indication. Okay, so again, anxiety, Valium, we use it for anxiety. We use Valium for seizure. We use Valium for sleep disorder like hypnotic medication to induce skeletal muscle relaxant. Okay, the next medication here in the list. Okay, the next medication here on the list we have Dantrolene or Dantrium. It's available oral. Dantrolene and or Dantrium available oral or injection. How this medication work? This medication work directly on the skeletal muscles by decreasing calcium release from ryanodine receptor from the sarcoplasmic reticulum. So decrease release of calcium from sarcoplasmic reticulum by maybe inhibit by affecting the ryanodine receptor RYR1. There is a risk of hepatotoxicity from this medication, Dantrolene. So if the patient suffers from cirrhosis or hepatic impairment function, we don't recommend to use Dantrolene. Dantrolene could be used for example, for chronic spasticity. Dantrolene, for example, if the patient suffers from cerebral palsy, we can use Dantrolene. And this is chronic treatment, like regular basis, every day, oral. Okay, we have it oral there. Or we can use it for malignant hyperthermia. So when you have malignant hyperthermia, that means we are speaking about emergency treatment here. Okay, for emergency treatment should be injection here. So the medication could be injection for treatment of malignant hyperthermia. We have Dantrolene, or oral for chronic spasticity such as cerebral palsy, Dantrolene or Dantrium. If you click on the medication name here, I will share the drugs.com page with you. This like a very valuable sources for us. Dantrolene injection prescribing. Scroll down, you can go to the indication and uses. Indication: injectable for supportive measure in patient suffer from malignant hyperthermia. You can see it here. So the patient suffer from malignant hyperthermia. If you scroll down to the end, they give you the maybe the pharmaceutical form, Dantrolene sodium injection available like 20 milligram per vials, and this information about the medication. Okay, so Dantrolene, now summary for Dantrolene: directly act on the skeletal muscles, inhibit decrease release of calcium from ryanodine receptor, sarcoplasmic reticulum. Black box warning for Dantrolene: hepatotoxicity. Most common side effect will be sedation and weaknesses. Uses: chronic spasticity such as cerebral palsy or like emergency treatment of malignant hyperthermia. Okay, the practice question here: which of the following drugs has spasmolytic activity and can be used also in management of seizure caused by overdose of local anesthetic? So the question: which of these medication? Okay, I will go back to the previous one. Okay, back again to the question. So the patient here, we have this medication has two functions. Number one, spasmolytic effect used for seizure. Okay, could be like overdose medication. Which one? So Baclofen, not for seizure. Cyclobenzaprine, not for seizure. Orphanedrine, not for seizure. Tizanidine, not for seizure. The medication for seizure and epilepsy will be diazepam. So diazepam could be used for both seizure and antispasmodic. Okay, next medication will be cyclobenzaprine, Flexeril. Cyclobenzaprine, Flexeril is a prototype, the first medication and the antispasmodic. What we have here, we need to remember two things. This medication carry the characteristic of tricyclic antidepressant. For this reason, I refer you to the antidepressant lectures to read about the information about this group of medication that carry a lot of side effect ADR, such as effect on the alpha receptor, muscarinic receptor, and histaminic receptor. So cyclobenzaprine prototype number one, antispasmodic. This medication structure related to the tricyclic antidepressant. What else? This medication carry the effect of anti-muscarinic effect. So when you say anti-muscarinic effect, okay, please apply it or try to remember the effect of atropine, because atropine considered like drug, prototype drug for the medication, atropine. So this cyclobenzaprine carry the effect of tricyclic antidepressant and anti-muscarinic side effect. This medication used to release spasm, to relieve muscle spasm associated with the acute painful skeletal muscle, cyclobenzaprine, such as neck pain, low back pain. Okay, this cyclobenzaprine, they said, this medication has strong anti-muscarinic action, strong atropine effect. This medication may cause sedation, confusion, and could be cause visual hallucination, blurred vision, dry mouth, a lot of side effect, and there is a potential of abuse of these medication. Okay. So this slide presents a summary about side effect and warning. Side effect and warning. This one here, side effect and warning, adverse drug reaction and warning. Okay, the question from the list, what we have there, if you remember, we have diazepam, we have baclofen, carisoprodol. Which of these medications carry the risk of hepatotoxicity? We have dantrolene, dantrium. Which of these medications need to be avoided abrupt discontinuation and cause withdrawal symptoms? We have diazepam, tizanidine, baclofen, carisoprodol. So three medication, we recommend to stop this medication gradually, not suddenly, because there is a risk of withdrawal symptoms. I will repeat it: diazepam, tizanidine, baclofen, carisoprodol. Okay, which of these medication maybe has the risk or has a characteristic of anti-muscarinic, anticholinergic? We have cyclobenzaprine and orphanedrine, Norflex. Okay, moving to the last medication regarding the skeletal muscle relaxants. We have another group of medication. We can speak about that later on. Okay, in this Google website, you can see the cervical dystonia could be different degree, torticollis for the maybe another name for cervical dystonia here, and the patient may suffer from painful spasm, muscular spasm. Okay, this is the last slide regarding the skeletal muscle relaxant. We have central acting spasmolytic drugs here. Okay, this last slide represents three medication not belong directly to the skeletal muscle, but they found later on this medication may be used for treatment of skeletal spasm or for spasticity or for spasmodic. The first medication on the list here, we have gabapentin. We have gabapentin urantine. We know that gabapentin belongs to the anti-epileptic drugs. This medication is normally used for seizure. This medication has the activity of spasmolytic effect. This medication also could be used for post-herpetic neuralgia. We are going to see some picture on Google image for that. Next medication, we have pregabalin or Lyrica. Pregabalin or Lyrica considered like anti-epileptic drugs. Pregabalin and Lyrica used for patients suffer from seizure. This medication could be prescribed for patients suffer from diabetic neuropathy. Also, we can use it for post-herpetic neuralgia and for fibromyalgia. So we have now maybe the second group belong to the anti-epileptic medication we use for fibromyalgia, post-herpetic neuralgia, diabetic neuropathy, and seizure. The last group not belong to the anti-epileptics. The last group belong to the antidepressant, and the brand name Cymbalta. The generic name for this medication, the Laxatine. So the Laxatine belong to the antidepressant, and the brand name Cymbalta. You can remember that Cymbalta belong to the SNRIs. SNRI stand for serotonin norepinephrine reuptake inhibitor. We know that the Loxetine, we use it for patients suffer from depression, major depression. We use it for patients suffer from anxiety. We can use it for patients suffer from diabetic neuropathy, number one in the treatment. We use it for fibromyalgia. So you have the maybe the brand name for all these medications: Cymbalta, Lyrica, Neurantine. We have the link for the medication. You can click on the link and read the information about these medication: gabapentin, pregabalin, Relica, duloxetine. So the question now: which of the following medication considered like antidepressant and used for for patients from fibromyalgia? Fibromyalgia. So we have the duloxetine. Which of these anti-epileptic medication used for antispasmodic and fibromyalgia? We have Lyrica, pregabalin. Which of these medication used for post-herpetic neuralgia? We have two medication. We have gabapentin and pregabalin. From the Google image here, I would like to share with you some pictures from related to the shingles or post-herpetic neuralgia. You can see could be affect the eye and the face, could affect the arms, or could affect the trunk or the body, the entire body. This one belong to the, and this associated with the nerve pain, neuropathy, and the patient suffer from severe pain. So for this reason here, for post-herpetic neuralgia, we have two medication, gabapentin or pregabalin, Lyrica, for this situation. Okay, this will end our lecture about the skeletal muscle relaxant, and we already discussed with you the group of medication belong to the antispasmodic, and another group belong to antispasticity. We discussed with you the carisoprodol, Valium, diazepam, cyclobenzaprine, orphanedrine, baclofen, and Botox, and a lot of medication, pregabalin, gabapentin, and duloxetine, Cymbalta, regarding the skeletal muscle spasm. I hope you enjoyed this lecture, and see you again and for the next lecture about the central nervous system, and have a great day, everyone.